Namaste, I am Dr. Abhinetri Hegde. National Cancer Awareness Day is observed every year on November 7th. So today I am here talking about the warning signs of cancer or the early signs of cancer which we should be aware of. Cancer is a generic term for a group of diseases that can affect any part of the body. The defining feature of cancer is there is a rapid growth of cells that invade the adjacent tissues and thereby spread to other parts of the body. So the process is referred to as metastasis. Today globally cancer is the second leading cause of death. So the process of metastasis, that's the primary cause for cancer deaths. So early detection of cancer that saves lives and cuts the cost of treatment. If not detected early, the chance of or the risk of death is more. Annually, or around 1/3 of cancer deaths are due to leading behavioral or dietary risks, those being the usage of tobacco, high body mass index, low fiber diet, and lack of physical activities and excessive intake of alcohol. Tobacco use is the most important risk factor which accounts for about 22% of cancer deaths. And economic impact is also, and social impact is also very significant. And late stage presentations and the delay in diagnosis and treatment, that actually is the reason for high mortality rate. So how we can detect it early? The cancer detection, if it is early, the better the chance of survival. And how to go about it? There are two major components for it. The first one is education to promote early diagnosis. So increasing awareness among the physicians, nurses, the healthcare providers, or even the general public regarding the early signs or early possible signs of cancer and their recognition, that will have a greater impact on the disease. The second one is screening. Screening refers to use of some simple tests across a healthy population to identify individuals who have a disease but they don't have symptoms. And if a person, if he reports to the screening on the earliest manifestation of the symptom, it substantially lowers the mortality rate. And if the cancer is detected early, the cost of the treatment can be, or the cancer could be treated with a fraction of cost that is incurred when it is diagnosed at a later or advanced stage. Let's know about the warning signs of cancer. So what are we should be cautious about? The first thing is the change in bowel and bladder habits. Any sudden or gradual shift in the routine. It could be in terms of frequency, or if there is constipation or diarrhea, or there is a color change in stools or blood accompanied with stools, that should raise suspicion, because these could be signs of colorectal cancer. And any significant change in the dietary or the bowel habit which is not easily explained by a dietary change, that should always raise suspicion. We call in colorectal cancer there will be pencil thin stools, so one should always have be aware of the changes in the body. And the second one is a sore or a lesion that is not healing well, or it's taking long to heal. A lesion or a sore which doesn't heal for over 3 months is referred to as a non-healing ulcer or a chronic ulcer or a chronic wound. A red nodule, or if there is a scaly, rough patch which often accompanied with bleeding, should always raise suspicion of skin cancer. These might also include a growth or lump or development of crusts also. And if there is a lesion which is caused due to constant irritation over a certain part of body, should also not be neglected. And coming to the oral cavity, if there is a non-healing ulcer in the mouth or a persistent red or white patch on the gums or the lips, tonsils or tongue should also not be neglected and immediately has to be brought into the notice of a physician. Simply putting, if it is not getting better over the time, if it is getting bigger, getting more painful, or if it starts to bleed, then you have to rush to the doctor. Then uneven or unusual bleeding or discharges. The most common thing is bleeding from breast, that is from nipples, which is an indicator of breast cancer. Breast cancer is not just limited to women. 1% of breast cancer reflects among men also, so they should also be very careful. And unusual discharges or bleeding from bladder, penis, or vagina or rectum. It could be a sign of colorectal cancer, cervical cancer or a prostate cancer. So they should not be neglected. And the other point is thickness or a lump in the breast or elsewhere, or testicles or elsewhere in the body. A lump in the breast. So after the age of 30, it's very important for a woman to go for self-examination, and she has to look for a lump or nodule in the breast. And if there is a small lump, usually the lumps or the small growths would be less harmful. Most frequently they are benign, but it doesn't harm to consult a doctor. And in most of the infectious diseases or infectious conditions, there will be enlargement of lymph nodes. They usually remain swollen for about 3 to 4 weeks. But if they are persistent and if they keep swollen for more than 4 weeks, that could be related with those lymph nodes could be in relation with the cancer latent tissues, and it has to be evaluated also. The other point is like indigestion, or there is a difficulty in swallowing. If there is repeated bouts of indigestion and there is difficulty in swallowing, especially for solids, and there is a jamming feeling in the throat, that could be a sign of throat cancer or stomach cancer or the esophageal cancer. And if there is a feeling of fullness with no food or with a less amount of food also, it could be a sign of stomach cancer. And the frequent chest burns, usually the chest burns or the persons having constant chest burn are not very serious. But if it is persistent, or the people having lasting symptoms despite using over-the-counter antacids, then that has to be evaluated elaborately. Obvious change in warts or moles. If the birthmarks or the moles are there and there is any changes happening in them in terms of the appearance, if there is asymmetry in that, or if it is growing in size, or there is color change, or there are bleeding points, then that should raise alarm, because these could be the signs of skin cancer. Bigger the mole, they are worrisome. And if there is nagging, cough or hoarseness, change in voice or hoarseness can be caused due to a number of reasons. But if it is persistent, or if it stops and reappears for at least 4 weeks, and thus a pattern has developed, then that could be a reason for a throat or lung cancer. And if a person is coughing blood or vomiting blood, and if there are streaks of blood in the sputum, and if there is a simple cough which doesn't go away, those should also raise concerns. Apart from this, if there is unexplained anemia, blood loss always causes iron deficiency anemia. If there is no obvious source for ongoing blood loss, that anemia has to be explained. Like if there are exposure to the radiations or be it a physical radiation or a chemical radiation, those people who are in that kind of jobs or those who have constant exposure to radiation, they should be aware of the hazardous effect of that, and they should get periodically checked for its ill effects. Apart from anemia, unexplained weight loss, night sweats, and persistent low-grade fever, they should also raise concerns. And the key message is early cancer detection strategies. They improve the outcome of cancer by providing better care at the earliest possible stage of cancer, and more effective treatment that is less expensive and less complex. So the awareness of cancer that plays a major role in fighting against the cancer. Ayurveda postulates the theory of maintaining a health of a healthy person. So, following a healthy lifestyle and a dietary regimen, especially the food, nourishing and wholesome food according to the season, and periodically and regularly undergoing shodhana or detoxifying therapies, they help in reducing the buildup of free radicals. Thereby, we can be safer from developing grave diseases. So to end up, I would like to say that let us be aware of the warning signs of cancer and protect ourselves from the greater suffering. Thank you.